Ivey, who is here now to talk about this government shutdown. First of all, where do people need to go? Well, let's start there. Let's start with a solution-oriented first.
Sure.
If you are in the path of this, what do you need to do next? If you know that your check might not be coming or you might not be going to work, what should you do first?
Well, I think the first step will be to figure out what the implementation plan is going to be for your particular department or agency. As of last night, the Trump administration hadn't issued those to all of them, but that'd be step one. Step two is, as you heard from your previous correspondent a few minutes ago, their local state governments, local and state governments are rolling out plans to try and help with the mitigation of this from an impact on federal workers standpoint. More information will come out today. I think Governor Moore is going to have a press conference in a minute. I think the mayor and the two labor secretaries are going to have a conference later this morning. I'm going to have a webinar tonight where we can roll through and take questions. It's at ivey.house.gov and it'll be at 5 o'clock. So we're going to try and have ways to have avenues to provide the information across the board.
Congressman, you know, you're the inside. We can't be in the halls of Congress right now to know. So what are you hearing? And is there any hope for any sort of deadline or resolution to this? Because it seems like so far right now the two sides are just so far apart.
Both sides are far apart. I think the Democrats are holding out for, you know, some sort of fix to the health care cuts that have been made by the Republicans, both in H.R. 1, the bill that the so-called Big Beautiful Bill, $1 trillion in cuts to Medicaid that we want to try and restore that. The other part is the expiration of the credits for the Affordable Care Act coverage. So premiums could double for many people over the next month or so.
To that, let me just ask really quickly, Wisdom, if the perception out there on the White House web page right now, it says Democrats have shut down the government. You're fighting for a
nice neutral position for them to take. Yeah.
You're fighting for health care. You're fighting for Medicare, things like this. How do you get that messaging across for people who are just going to see the messaging that's coming out of the White House? How do you fight that?
Well, we've been doing our part of it as far as reaching out through TV shows and the internet and the like. But at the end of the day, notices are going to go out in the next 30 to 60 days for people that are going to tell them that their premiums are about to increase, in some instances double. And I think once that message lands, people are going to get on the phone and start calling their representatives and say, I don't know how you fix this, I don't know who caused it, but get it done now. Right. And I think that'll get the Republicans moving on this.
And now I've heard a lot of conversations about insurance and loans as well. Are these ways that could sustain some of the people that could be affected by this, at least in the short term? Because last time it was 35 days or 30-something days.
Yeah.
Are these also, I know you're going to have the webinar, are these options as well in Maryland?
Yeah, I think there was one option. In fact, I think the correspondent just mentioned one of those. I think it was like for $700 that she mentioned there. So there are going to be those possibilities. And of course, furloughed employees, they'll get the back pay, provided the Trump administration doesn't, follow through on the punitive terminations that they've threatened to make. But yeah, I think at the end of the day, the goal is to try and resolve this as quickly as possible so people can get back to work and people can get the services they need, but also to cancel the cuts that have been made to health care.
Real quick, to follow up on that punitive termination topic, because we've seen this administration go hard and just try to get rid of people.
Since January 20th.
Right.
Yeah.
So how do you stop that from happening, given we've heard the conversation saying, okay, well, it is what it is. Some people will probably lose their jobs.
I think there's a couple things. One is we've already seen that they've recognized they've cut too much. So they're trying to quietly bring people back to fill in so people can actually get the services they need. Because when it comes up short, the public complains and they hear from that. And that happens in red districts, just like blue districts too. The other is litigation. There's a case that was just filed yesterday based on that threat that the president made and OMB made. We'll see how that resolves. We've had some success with court cases, some of them not. The Supreme Court's rolled back some of the injunctions. But we got to make sure we fight on both fronts. But at the end of the day, it's going to come down to the health care issue. And I think that's going to drive things towards a relatively quick resolution and hopefully a restoration of health care benefits for the American people.
Lots more to get to. You're sticking around, right?
I can stick for a while.
Oh, okay, never mind.
And then you got to go to work. I
had a rumor you were here later in the day, so
we'll be back. Yes.
You'll be back
Yes.
Noon.
Yes.
Okay, we'll see you at noon. Thank you so much for joining us.
We appreciate
Thanks for having me.